Back in the classroom, but with new fears. Topping the list for many are school shootings. That's coming up on the Morning Medical Update. Good Monday morning. It is August 15th. I'm Jessica Lovell. We are here inside the Dolph C. Simons Jr. Family Broadcast Studio. Thank you so much for joining us on Facebook, YouTube, and on Twitter. We check in just a bit with Dr. Dana Hawkinson to get our latest COVID count. Plus, are your kids anxious about school? If so, they are not alone. We have a great panel of experts today. Child psychologist Dr. Danielle Johnson is here, along with Executive Director of Mental and Behavioral Health, Lauren Lucht. Ladies, good to see you today. Also joining us virtually is Ad Hoc Group Against Crime President Damon Daniel. And of course, we always want to hear from you. What concerns do you have right now as your kids head back to school? What questions are on your mind about COVID and other viruses out there? Send us your questions on the chat thread or via email. A Pew Research study shows that a majority of teens worry about a school shooting happening on their campus. This on top of recent surges in depression, anxiety, and suicides. Last year, 3 leading pediatric organizations declared a national emergency for children's mental health. Dr. Johnson, how do we talk to our kids about those fears of school shootings? I mean, is that even something we should be talking about? Kind of tell us what we should be saying and to what ages.
Yeah. It all depends on the age of your kiddo. So we've got elementary school kids that may not be as aware that school shootings happen. So if they were to ask a question because they saw the news perchance and ask a question about a school shooting, you would frame that a lot differently than our high school students who are keenly aware of what can happen on a high school campus. And for those of us that live locally, that we had a high school shooting last spring in Olathe. So talking to your kiddos about safety. I know a lot of the school districts have safety trainings that happen as young as kindergarten. And so I know for our school district, we have ALICE training. They talk about how to stay safe. And so talking to your kids and your schools about what do your schools do about safety and training. So having a really good awareness for parents to understand what the schools do so you can then incorporate that into your conversation with your child. And so talking to younger kids is going to look a lot different. Older kids to really acknowledge the fact that that is a scary thing, that those things could happen. And what will we do to be safe? Incorporating, again, what your schools are going to do. But then, as a parent, I want my kids to be safe. So I want them to run and be safe. And if you can get out of the building, get out of the building and keep going until you get to a safe spot or a trusted adult that can call police.
And we've talked about this, how you have to just kind of hit it straight on. But do you wait for something to happen and then you proactively talk to your children, or do you wait for them to ask you the questions?
It's going to be very, I think, dependent on your kiddo. There are some kids that are more anxious that talking to them about it when they've never mentioned it will make them more anxious and create kind of maybe bubble up some of the anxieties they already have. For those kids that may have already heard about it, and I think as a parent to say, hey, there's lots of things happening in the world. The news is on in the background. When you guys hear the news, what do you have questions about it? What have you heard, actually? Just to get a sense of what they've heard, and then are there any questions, or do you have any concerns? And I think that's a daily question as a parent who picks up and drops off a lot. I ask my kids, how was your day? What was fun and exciting? What was unfun and not so exciting? To get a sense of what was good and bad, roses and thorns of their day.
I was going to say your roses and thorns analogy. Well, and I like the idea of the open-ended questions. What have you heard? So that can kind of engage the temperature on where they're at with what they know. Dr. Johnson mentions anxiety. Lauren, we know that's a big risk factor for suicide. The National Institute of Health reports suicide is the second leading cause of death among teens and young adults. So what is the most persistent misunderstanding when it comes to teens and suicide? Kind of dive into that for us today.
Well, I think from my perspective, the biggest misconception that we are trying to fight against is this idea that if we talk to our kids, we will somehow make that happen. And so I think there are a lot of parents that just, again, we don't know when our kids start to understand and see and fear and react to that, what's going on around them. And so you've just really got to have that conversation, find out where they're at, even if you frame it in the sense of, do you check in on your friends? Are you supporting your friends? And you can kind of gauge their understanding or any concerns they have about suicide risk for their friends themselves or other family members. Talking about it does not make it happen.
Very good advice, because I've asked that, and Dr. Johnson, we've talked about that too as well, just about the idea of, you want to talk about it, or again, find out what they hear or what they know on that topic. It's a really sensitive thing to talk about. Dr. Johnson, I want to ask you, in adults, April, September seem to be the months where suicide attempts go up. Do we know the time of year that teens are most vulnerable, and why?
We can see there's some research that supports that school and the stress from school and having multiple events at once can be a stressor. There are many kids who do have depression, anxiety, who function very well, who parents don't have any idea that they're really struggling. And so being able to, again, have those check-in questions of, how are you doing? Any struggles? And to really sit down, I think we are quite busy these days. And so our ability to actually sit down and face-to-face with our kids, ask them the questions, let them know that we're always here no matter what. But there is some research that shows that school, so beginning of school, we have finals, we have midterms. There are peaks in the academic year where things are just more stressful.
It's interesting though, because school could be such a great time of year for certain kids, and then it can be a really unfortunate time of the year for other kids. Have you noticed that, Lauren, as well?
I have, and I do think it, to Dr. Johnson's point, does play around a lot of the deadlines and the pressure. One thing we've seen a lot of is just athletes and the pressure that are on our students who are participating in athletics, and then that pressure climbs as they're approaching opportunities for college. And so I would say, as people are getting college rejections, injuries, I mean, those are all things that we need to remember for our teen population. I don't know about you guys, but I remember thinking 4 years felt like forever when I was 16. So when you're thinking about things that may happen during the school year, or how anxious does that make you about going back to college, and sort of where are you at? Those are all sort of things that can play into those scary thoughts that we're having. And again, that's why we've got to talk with our kids, right? Because we now know clearly 4 years goes by really fast.
Well, and it's also hard because I think too, you think, I've been there, done that, I made it out okay on the other end. We know that as adults, but to kind of go back in time, back to those high school years where everything is a big deal, where those stressors are really high, where it's hard to look at them and just go, it's really no big deal, you'll be fine. In their mind, it doesn't feel that way.
And that's why we have to have the conversation, right? Because we're like, we made it.
You're good.
We're fine.
You'll be fine, I promise.
You'll be fine. But it doesn't feel that way, which is why we have to say, well, here was my vulnerability when I was your age and the things I was worried about. Tell me what you're feeling.
Yeah.
And we've got a different piece that did not exist when I was a teenager. We have social media that also takes an impact on kids and their functioning, and the fact that we think about school bullying happening at school and people making comments at school, and that's where it was left at, a generation or 2 or 3 ago. And these days, those comments don't stay at the school. They come home with you. They're in your
There's
whatever
no escaping
feed.
it.
Yeah, it's kind of everywhere, and that becomes another source of stress, depression, and anxiety. And we have an increasing number of kids that engage in substance use, which we know if you're using a substance, you're kind of turning off the ability to stop and think that is not already formed yet in our teenagers. They have a few more years for that brain to keep cooking before that stop and think ability is there. So if you have a kiddo that may be depressed or having some anxiety, who then also use substances, and so that filter to stop and say, how I feel in this moment is truly temporary, and this will not last long, they lose that ability to stop and really realize this is a temporary situation. So we have some kiddos that really respond to that feeling in the moment, and they attempt or do complete a suicide.
Damon, good morning. How are you?
Good morning. I'm doing great.
Hey, thanks for being with us today. So we know youth violence is also a leading cause of death for young people. We hear the stories, we see the news. Explain, though, what Ad Hoc does in the community to address the violence and just the fears of potential violence.
Well, thank you. It is a pleasure to be here. So the Ad Hoc Group Against Crime is a nonprofit organization that serves the Kansas City metropolitan area. Primarily, particularly as we think about youth in our city, we offer a variety of services as it relates to cognitive behavior intervention, counseling, as well as other sort of healthy relationship classes and things like that. We are a partner with a program called Revive, which stands for Reducing the Effects of Violence Through Intervention and Victim Empowerment. And this is a partnership between the University of Kansas Center for Human Health and Development, as well as the University of Kansas Health System, and Wyandotte County Community Corrections as well, and several other partners throughout the Kansas City, Kansas area as well. So primarily our role as it relates to the Revive project is really to respond when there's a youth or young adult who's been intentionally injured and show up to the emergency room. Our goal is to really connect with that young person, make sure that they have the support that they need once they are released from the hospital. We provide counseling services as well as connecting them to much needed community resources as well. We recognize that, violence is a social determinant of health, and when our young people, primarily as we're talking about returning to school, many of them, when they have this, repeated sort of exposure to crime and violence, it can be linked to an increased negative health outcomes. For example, people who fear crime in their communities may engage in less physical activity, which then could result to, poor or self-related physical or just a lack of physical activities, and also mental health as well.
So, Damon, have things gotten better from where you sit? What has really made some of the bigger differences?
I think that, it's tough to say if things are getting better when I see every day that the younger, when it comes to those who are perpetrating crimes, those who are victims of crime, are getting younger and younger. And it kind of goes to what Dr. Danielle said as it relates to social media and things like that as well. You can't, if you're at school and you're being bullied, back in the day, and I totally am of the same generation where you're able to leave that stuff at school, but now it follows you home, and it stays out there 24 hours, 7 days a week sometimes. And so as it relates to things getting better, in that regard, it's not. But also, though, I think that some of the areas where things are increasing is in terms of getting better, is more organizations are coming together and working more collectively to address the issue. And so that, to me, is definitely making things a lot more better.
I want to get to a couple of community questions today. John wants to know, my child comes home visibly upset after active shooter training at school. You mentioned Alice, and these are what kids are required to do now. So he's saying he knows they're necessary, but how can I prepare my child for these drills? What's your advice?
Great question. One, talk to the school. Maybe get a heads up from the school. If you know your kid is a nervous kiddo or gets really upset with these drills, talk to the school and have your teacher give a heads up when these drills are coming, and you can prepare your student maybe the day before, probably not much more than the day before, but the night before, and say, hey, you guys are going to have a drill at school tomorrow. These make you really upset, and we understand that, but these are a safety precaution, just like we do other things to keep you safe, and maybe coordinate with the teacher that, my son John has a struggle with this, and so I've told John, and then the kiddo can know maybe to go to the teacher or have a special place to go, or debrief with the counselor that they're really nervous, up, kind of bring them back down, ground them, and make their anxiety a little bit less and less upset. But again, we're going to reiterate, we're doing things to keep our kids safe, and that's what we're going to keep
and being
doing.
Proactive and talking about it. Any advice you have, Lauren?
I would say, definitely debrief. A school counselor would be great to check in afterwards, but then ask about it when they get home, and hopefully you can sort of take the conversation you had the night before to sort of be prepared, combined with let's talk about how it went, to create less anxiety around the drills, because ultimately they are designed to create a safe option for avoiding a bad outcome. And so if we can help our kids reframe it as something that's positive.
Yeah, gives them some control.
Yeah.
Absolutely, yeah.
Okay.
Far better to be practicing it in a drill.
Right, absolutely. So Michelle has a question, and this is a tough one though, asking point blank if we could ever stop school shootings or suicides. She says it feels just really overwhelming when you're constantly hearing these stories in the news. It's really a lot to take in, I think, for a parent.
It is, and because of social media and because of how connected we all are, we all know what's happened. And so it's not just a story in a community, but it's a national picture of really high risk for suicide for our teens and adolescents and pre-adolescents. And it's scary that the numbers keep going down in terms of age, but that's the benefit to social media. They're already connected. So having a conversation with our kiddos is not going to plant that seed. So just all the more reason we've got to have that open dialogue with our kiddos.
I was going to say, it's a lot for kids to deal with, but it's now the parent has to figure out new things to navigate and new skills on how to talk. It seems like there's like a new issue coming home every day. They're like, wow, I haven't had that problem yet, or I haven't had to have that conversation yet, but I guess we're going to start.
Right,
So,
and that we didn't have to have those types of conversations when we were in school.
sure didn't feel like it, did it?
No, it didn't.
Well, let's talk with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control this morning, joining us on this Monday with our COVID count. How'd we do over the weekend?
I think we've gone down a little bit. I think the trend is going down, which is a good thing. Right now, 21 active infections in the hospital with 3 in the ICU, 2 on the ventilator, still 21 in that recovery period. But hopefully we are getting from those high 20s for active infections down to the low 20s and even lower. We know that nationally the cases as well as hospitalizations have started to see more of a decreasing trend.
Okay, the FDA says take 3 home tests if you're exposed to COVID to boost accuracy. You agree with that?
Yeah, I think we have some good published data showing that the antigen tests, they aren't as highly sensitive as those PCR tests that you get at, say, the clinics or the pharmacy. So I think that is surely accurate, and it's even there in their CDC website is, if you are negative, but you are having symptoms, you may have to test 1 or 2 or 3 days to get that full result.
Yeah, it doesn't hurt to keep testing. Okay, hundreds of Americans still dying of COVID-19 each day, despite the signs that this latest surge may be slowing down. So help us understand exactly what that means. Numbers are up, but the surge is slowing.
Yeah, again, we know that hospitalizations lag behind the actual cases. But we know that deaths lag behind those actual cases as well. And so as we are starting now, I believe, to see that downtrend in hospitalizations, we still have those people that have been in the hospital a while. That's why we are still seeing those deaths. But hopefully as we get further out into this and we have these reduced hospitalizations, the amount of death will decrease as well. But again, remember, so much of this is very, very preventable. It starts with vaccines, being up to date with vaccines, and then of course getting tested early if you do have symptoms. That's why we are talking about, do you have to test several times if you aren't going to those medical clinics to get those PCR tests if you're doing it at home? Because if you can get that, and especially if you are high risk, getting on those outpatient treatments like Paxlovid or the monoclonal antibodies is essential, and that is really what is needed, but doing it as early as possible after those symptoms start offers the best benefit.
Let's talk monkeypox. What can you tell us about the latest numbers?
Yeah, we have seen our numbers increase in the United States quite dramatically over the last few weeks. Right now we have 11,000 cases in the United States, 20 cases detected in Missouri, 3 cases in Kansas. We know that there are ongoing efforts to try and speed up and make diagnosis more efficient. But also now, luckily, we are really starting to roll out the vaccine. I think that is a good thing. I believe that the new FDA guidance for extending our supply of vaccine right now until we can get more is good as well. And certainly here at the health system, we have started vaccinating patients and will continue to want to do that, again, to try and protect those most at risk right now.
And lastly, Dr. Hawkinson, any precautions or advice you have for students heading back to the high school setting or certainly the college setting where they're living close together in close quarters that they can take regarding monkeypox?
Yeah, our best evidence continues to be that, again, this is not spread like SARS-CoV-2. Can there be some respiratory droplet spread? Yes. The best evidence, the best data that we have right now supporting what is the method of transmission is that close contact. It is not going into a room, a classroom with somebody. It is not shaking hands with somebody. It is that more close and longer duration, intimate skin contact. So really there is a lot of safety in that, but also that goes to talk about continue to do those things about infection prevention and control, and that is certainly hand hygiene seems to be one of the most important things to do. But again, this is not a casual contact disease transmission right now from what we know, and so it's important to understand that and not necessarily have that anxiety if you're going into a classroom or you're going into a lecture hall or something like that. You're going to be safe. So I think that is the biggest thing is, what how it's not spread, because I know people are going to be anxious about that as we are getting back together now for the school year and getting into some of those settings.
I think that's a good peace of mind, because we know last week when we were talking about monkeypox, people had those concerns. So I think you're helping put that to ease a little bit. So thank you for the update. Reducing the effects of violence through intervention and victim empowerment is a community initiative better known as Revive. Damon mentioned this earlier. I want to give a little bit more information about this. The University of Kansas Health System is collaborating with the Ad Hoc Group Against Crime, Wyandotte County Community Corrections, and a federally funded grant program that's based at the University of Kansas in Lawrence. The goal is to break the cycle of violence. It connects patients admitted to the health system because of a violent act with support services for up to 6 months. So to qualify, a patient must be 12 to 24 years old, live in Wyandotte County, and be a victim of violence. So if you're just joining us, we are back with Ad Hoc Group Against Crime President Damon Danielle, child psychologist Dr. Danielle Johnson, and Lauren Luck, the Executive Director of Mental and Behavioral Health here at the University of Kansas Health System. So welcome back to you. And Damon, just you mentioned a little bit before, but for those who may have missed it, why does Revive target teens, tweens, and those adults between 12 and 24?
Well, a good number of those that are admitted into the emergency room fall in that area, in that age bracket as well. And we feel like if we're going to get upstream and try to reduce the effects of violence and also break the cycle of violence, we have to meet those young people between the ages of 12 and 24 before they get beyond that range.
So, Damon, how are you measuring success out in our community? And maybe how do we compare in other programs like this across the country?
Well, I think there's a Thrive approach that we take, which has sort of three aims. One is in terms of examining the impact that we're having and being very intentional as it relates to the target population. And so as we are intentional about showing up to the emergency room, to the bedside, making sure that we're connecting with those young people before they are released from the hospital, that's being very intentional there. I think secondly is then looking at the family dynamic as well, and making sure that we're able to connect those young people to programs in the community. And then I think thirdly, the third aim as it relates to us being able to evaluate this is really looking at how we are coordinating programs, policies, and practices that are not only increasing the knowledge of those who are involved in terms of the staff, but also those individuals, and raising awareness for youth as it relates to violence, and looking at how we can build resiliency and increasing social skills to cope with violence in more healthier ways as well.
So, Damon, I know this program started during the pandemic. How did that impact your reach? What effects did COVID have on the work you do?
That's a great question. Yeah, it really impacted us quite a bit, because we were not able to come into the hospital physically and meet with those youth. So the participation was very low. I will say that it has increased because I think that all of us have gotten better at explaining to individuals what Revive does and who's involved and what the benefits are. But definitely as it relates to being able to connect with those folks right then and there, being prohibited to even come into the hospital during COVID was a big challenge for us.
So, Dr. Johnson, how critical, how important are programs like this for these types of victims of crime? What I hear Damon talk, it sounds like it's not just in the moment care, but it's following someone through to make sure that they are getting all the resources they need, not just in that one moment. But
I think that's vitally important, and I really appreciate the work that you're doing, Damon, over there, because we need it. We've seen kids at Marillac who've been hospitalized who have not only themselves been victims of violence, but they've lost people, and these are teenagers that have lost friends. I remember one patient who had lost 2 friends in the last year to gun violence. And she was 15 or 16. And as an adult, that's hard to fathom, losing 2 friends that you care about, but to be that young and to lose friends in such a difficult manner would be hard. And so for these kiddos to be able to have some support that's longer term, the risk factor for these kiddos are they're going to engage in violence. They're going to not go to school. You talked about the health impacts that they will become a statistic we don't want our kids to become. And so if we can have support to let them know that there are other options to respond with violence to violence, if we can let them know that academic success is a gateway for more opportunities for their lives, if we can let them know that there are trusted adults who are there 24/7 when they need something, that they've got people they can call, that they are truly not alone. I think will help buffer the impacts of post-traumatic stress or acute stress disorder, will help buffer against depression and anxiety, will help buffer against ongoing violence. And so I think that programming is amazing, and I hope we can see that spread to kind of all the communities. We tend to think about Wyandotte County and Jackson County, Missouri side, but there's an outcropping of violence that's happening. I think there was 2 teens killed in Raytown in the last week. So I think that being able to see that we need to expand some of this intervention beyond the urban core to other parts of the community, I think will be a great asset.
No area is immune.
No, I think we think about certain things happening only in one pocket, and that's no longer the case. I think things happen everywhere. Yeah,
we see it every day. I want to get to some community questions, if we can here. Joellen says, I find that asking a child or teen, how are you doing, usually elicits the typical response, fine. We know that. I'm fine. I don't know how many times I said that as a kid. I'm fine. Stop asking me. But what's a better question that might surprise a kid? And I want to hear from both of you. What kind of questions you might ask that could get some good information out of them.
To be playful, you can say, well, tell me a good fine thing about your day and tell me a bad fine thing about your day. But you can expand that language of, really want to know, give me some highlights and give me some lowlights. Or what's something that you maybe don't want to say, but your mom or dad would be really want to know, just to have a conversation. And I think maybe setting the expectation with your kids that every day I'm going to ask. Every day I'm going to want to expect you to say something to me that tells me, really, gives me an idea how your day was.
And tell them it's okay that it's not always good. I think when you get in and you press play and the recorder goes off and mom says, how was your day? We all say it. And they know that they're expecting to say something. Yeah, it's great, whatever. But to say, hey, anything happened today that,
well, and it's socially acceptable. I mean, right, when people say, how are you, we've all learned that the answer is great or fine. And so to model that for your kids behind closed doors when we're at home is another opportunity to be vulnerable in front of them and to show that. Because our kids know when we're fine and
not fine.
Good.
Yeah,
right? Like they can tell. And so if we're not modeling that ability to be vulnerable and say, here's something that happened in my day I wasn't expecting, what things popped up in your day.
Yeah.
And it just
doesn't mean it had to be a bad day. But
doesn't mean it had to be bad. But we're not always all fine all the time. And so to help our kids understand, socially people will ask you, and you don't have to tell everyone how you really feel about everything. But
could you imagine if we really did that?
I mean, I don't know that we'd ever get through anything in the day because we would just be trying to help each other not be fine.
Yeah.
So again, helping them realize, that's a socially acceptable answer.
Yes.
But families and friends go beyond. If I ask you twice, I really want to know.
Yeah.
I really care.
It's not the obligatory, tell me how you're doing. I don't really care. I really want to know. Damon, jump in here on that. What you talk to youth all the time. What any advice you have on just some good conversation starters for them?
Well, I think if you notice that the youth is visibly upset about something, I think the leading question is, what happened? What happened to you? I think that usually helps start some things as well. But we also have to create a sort of safe space for kids to be able to report things and anonymously as well. So with us, when we are approaching young people, we already know that something has occurred. But to break the ice with them, it's really about creating a space so they feel comfortable, and then getting into the meat of it. And that always starts with either a question about, can you tell me what happened to you? Those sorts of things is really kind of where we begin the conversation.
My boss here, Jill, you all know her. She always says there's no wrong answer. She'll ask a question and go, no wrong answer. It's okay to just tell me. It's okay to just tell me what the answer is without any repercussions. So
absolutely.
I love that.
And it's so important to focus. I loved that language. What happened to you? When we say what is wrong, we leave it open for interpretation that the kiddo or any of us
did something
did
wrong.
something, or it's somehow a defect in us, and maybe we're not resilient enough, right? How did it go wrong? It does feel
Puts
a
it
little
back on
bit
that
like
person.
you. Yeah. So what happened to you? Acknowledging that something external has changed the way you feel, which is a totally normal experience.
Right.
And reacting to it is appropriate and healthy.
Sean wants to know, what about kids going to college as freshmen? I mean, my gosh. We just had a going away party for my nephew heading off to Colorado, and I'm always thinking, what is that like for a kid to be sent off away from the folks for the first time ever? I mean, it's such an exciting time, but what advice do you have for those parents sending their kid off into the world?
I've got 2 high school seniors I've worked with for the last 1 to 2 years, and they're going away to college. And I feel like their 3rd or 4th or 5th parent, like sending them off into the big world because they're both going away from here. And so we've had conversations about, well, what do you do to support yourself when you get there, and how do you utilize family when you're going to be either hundreds or 1,200 miles away from your family? How do you utilize that support? But also for you parents of high school seniors, now college freshmen, talking to your kids about accessing services on their college campuses. Most college campuses have a community or a college counseling center. So for both of the seniors, now I call them freshmen, now they're freshmen. We've looked up online the college counseling center on their campus, and they've got the phone number and they've got the resources set. So having that kind of physical piece of paper, or no, I'm dating myself, having that in their phone so they have that information in their phone and saved is important. But then for parents to be able to check in with their kids, and this goes back to when they were in kindergarten and 1st grade when you check in with them. This is the same kind of check-in that evolves, but it still happens, that you want to know how exciting they are or how scared they are, because moving away for the first time and living on your own, it's scary.
And it's okay
exciting,
and it's okay to feel both ways.
Yeah. Oh, yeah.
Scared and excited.
Yes.
And that's all the good feels, and it's all part of it.
It's supposed to be that way.
Exactly,
Yes.
exactly. Yang Lang wants to know, is there any connection, and we talked about this a bit, between fear and the seasons? He says, I feel stressful in the fall when he was a teenager, which again might sync up with that time of year going back to school, but then people talk about as you get into the winter months, people maybe have more depression or get into that winter funk. Is this true?
I think it certainly depends on the age group. But in the fall, we've got people doing our SATs and our ACTs, and there's just college applications are due. So I think really knowing your kid and the deadlines and where they're at, and times to be extra sensitive to adding things to their schedule, or how can we sit down and sort of make a plan to get through this month, because it's going to be rough. Because I think we do all have our own times of the year that we've sort of learned to pair stress or associate stress with. For me, it's budget season, but that's because of what that's because that's what I do, and I'm trying to help grow a service line, and mental and behavioral health access is so important. But it really you've got to just learn what that stressful time of year is, and then understand the why. And then as parents, we can try to predict, okay, what other things might be similar to that. So I know those are times they want to reach out.
And then find good resources and good coping skills and mechanisms that are good and healthy.
Yes.
And move you forward through that season. Dr. Hawkinson, a couple questions for you. Gene says he just checked the CDC community transmission map of the U.S. and it said it's mostly red, 93.95%. How is that decreasing?
We'll have to see how they do calculate that. What we are talking about is the amount of cases that are reported. Again, we know there are caveats with how the cases are reported. Number one, because there aren't as many testing sites that are accessible. Number two, a lot of people are testing at home or not testing at all. So what I'm going by is the Washington Post trends and cases for that, and what we have seen really for the past few weeks is somewhat of a plateau, kind of up a few days, down a few days. It looks like maybe there may be a more trend towards overall decrease as far as cases. And the same thing goes with hospitalizations, although hospitalizations were more on the increase based on that. And we know Dr. Stites likes showing those heat maps as well, and so you have to understand exactly what they're trying to count and things like that, but that's a good question. But again, I'm going from the Washington Post and what they are reporting at this point. But again, we know there's caveats that have been in that reporting of cases, just for what I stated.
All right, last question is from Shirley. She said she had her last of 4 COVID shots on March 29th of this year. Is there a COVID shot available this fall along with the flu shot that she should get and wait and get that?
I think we're waiting for the recommendations for that. We do anticipate that bivalent vaccine, meaning 2 different spikes, so the original spike and then probably a BA4 or BA5 spike encompassing that vaccine. So we are waiting, number one, for that vaccine rollout for that booster, but also the full recommendations from CDC and the Immunization Practices Committee on what exactly everybody should get. I think most of us do anticipate that for everyone, a booster or another dose will be recommended.
All right, let's get to our final thoughts from our guests today. And Lauren, I'm going to start with you, and hopefully you can include anything I didn't ask you. It's such an important topic, and I don't want to leave anything on the table that one parent could be out there listening and hear the right word and the right advice. So just anything else you want us to know as we head out today.
I think my thoughts would be just focusing. Access is hard right now. It's great. Mental health is finally destigmatized to the point where people are reaching out. They are asking for help, and that's wonderful. But we also have a shortage in the country of qualified professionals to be providing these services. So Dr. Johnson's point about college counseling centers, utilize your own EAP for your kiddos. That's an option too. One of the great things about kids is they are almost always universally insured. Call your insurance company. They have case managers. It's the smaller number on the back of your insurance card that says for mental health benefits, but they do have case managers that if you explain as the parent, they will help connect you in times of need. And don't forget your community mental health centers along the way. And so there's lots of help out there. You have to be creative finding it. You might have to string some things together. We're working really hard to add providers and add access here at the University of Kansas Health System. And then take a picture of those resources and have them heart it in their phone so they have it right there. And we as parents have to have the same thing in our phone so we know who to go to. We
help them seek and find out so they know. Yes. And the resources are there, but like you said, that's kind of new. And so now we've got to figure out how do we find those resources now
how
that
do we
people are coming to the
that?
table. Right. Thank you. Great advice. Dr. Johnson, what haven't I asked you? What should we know?
I want to kind of probably reiterate the fact that we have exciting times coming upon us with school starting, but also for a lot of kids and young adults that are going to college, also quite scary times. This has been a rough 2 years for a lot of our students, and so being able to acknowledge that and talk to your kids. So I'm going to implore everyone, a daily check-in, not only with your kids, but what about your spouse or your mom or your dad, just checking in on each other. I think that's become quite important. And so if we hear something or see something, we should say something. If you see someone that's looking kind of down, I'm going to use Damon, what's happening, what's going on, to have that conversation with people, because that one conversation may be the conversation that a person can open up, and maybe you've reduced that person's risk of attempting or completing a suicide.
Check in on
asking a question.
Everyone around you. Look and see people. Damon, thank you so much for being with us today. What are your final thoughts for us?
Well, thank you for having me. I just want to piggyback on a couple of things. Number one, I think it's really important to encourage our young people to share what they are seeing and what they are hearing, and then creating a space for them to be able to report what they're seeing and hearing, whether it's anonymously or at least a judgment-free zone. And so, especially when you think about the fears that kids may have as it relates to school shootings and things like that, or even bullying or suicide. If they're seeing these things on social media, let's make sure that they understand the avenues by which they can report these things and not be judged, not feel like they are snitching on someone, but that they are giving that information to someone who's going to do something about it and that's going to listen to them and hear what they have to say as well. So let's make sure that we're creating those spaces and making it very well aware of how they can report that information. That's going to help save a lot of lives, because communication is going to be key as we go forward. And then secondly, I would just say, and this echoes what Dr. Johnson just said too, the regular communication with our young people, especially if you got kids that are going away to college, making sure that there are definitely some check-in times that you have with them, whether it's daily, in the evening, or at night when you know they're not going to have classes. Being able to check in with them is going to be extremely important too. So those are just a few things that I would add.
Great. Thank you for that advice, and thank you for the work you and your teams are doing here in our community. We appreciate you. Dr. Hawkinson, final thoughts from you. Are your kids back in school yet?
I think this week. They get back into school,
That's
so
that
that'll
time.
be good, and we'll certainly have those discussions with them and make sure everything's going okay. Asking those open-ended questions. I think that was great advice that we heard today. So.
All right, thank you. Okay, thank you all for being with us as well today. Don't forget you can catch our updates anytime by logging on to Facebook, YouTube, and Twitter. Coming up tomorrow, a mother-to-be loses her baby during the height of the COVID-19 pandemic, how she turned her tragedy into a way to help other new moms. That's Tuesday on our Encore presentation. We'll see you back here, though, live on Wednesday at 8 a.m. The number of kids turning to their local ER to seek help for their mental health has doubled, according to the CDC. Wednesday on Open Mics with Dr. Stites, we take a look at the mental health policies in schools and how the staffing shortage is impacting education.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.